You are listening to Here Before, Here Now, an Arizona's Family Originals podcast.
Hey guys, Colton here with my podcast, Here Before, Here Now. Taking a couple of weeks off because we had redone our podcast studio. So this is the first time that we're doing an actual podcast here. It's updated. It looks super cool and super sleek. So I'm really excited to have my first guest with this newly renovated podcast studio in studio for us. Today we're going to be talking to Michael T. Allison. He jokingly told me that the T stands for terrific, and he is going to talk to us about tribal health inequities and also how tribal communities are, facing health challenges and how they're overcoming it. He was part of the Arizona Department of Health Services for a couple of decades, and he served as the Native American liaison. And really, he went out to these tribal communities and really put together a comprehensive package, I guess I would say, in helping to address these issues and also to make sure that tribal policies, cultural beliefs, and knowledge was incorporated into how we treat indigenous communities. So, Michael, terrific Allison, thank you so much for being here.
Well, thank you, Colton. Thank you for inviting me.
Absolutely. Would you like to introduce yourself, just kind of about who you are?
Yes. As you know, in Navajo, we introduce ourselves with our clans. So I am Jose Tachini and Nakaidna Pashchin and Dashiche Matashkiji, Shanale Senajini. I see not Aninez and Nasha. So my four Navajo clans, and I'm originally from Shiprock, New Mexico.
Awesome. I've been to Shiprock so many times. I lived in New Mexico. Such a beautiful area. Yes. With the formations of the rocks and everything.
And the farms and the river.
Yeah, absolutely.
Yes.
Do you miss it?
Yes.
Yeah.
Yes.
So you were telling me that you just got back from a trip helping your daughter move, right? To Kayenta. Right. So how's that going?
It went real well. A lot of work. She just accepted a job in middle school teaching social studies.
Wow.
So we moved her in. Really nice housing, beautiful area.
Yeah.
Yes.
So serving the Native community is big in your family, right? I mean,
yes.
Moving back up to the Navajo Nation. What drove you to become a policy expert or a policy driver for healthcare in Native communities?
Well, I guess maybe just the culture in terms of first helping your family, helping your community, helping your tribe, and then knowing in the workforce that policy is really important. And that drives the work. And so I believe that's how I ended up getting into policy.
Mm-hmm. Is it something that was kind of just at the forefront of your mind as you were going into school, that health was important?
No, actually, my educational development's very interesting because, as you know, in our culture, we're just told go to school. And, of course, our parents and our grandparents aren't professionals in terms of academic education. So I just got into my field the day before college started, classes. I opened up the college catalog, and it stopped on business administration. I didn't know what it was, but that's where I started.
It just sounded cool.
Yeah, and then I got an MBA, and so I got really two careers. Economic development, and one of my jobs was economic development director for the Navajo Nation. And then I got into healthcare, and then I got a master's of public health.
Wow. I mean, those areas are all much needed in tribal communities.
Yes, yes.
Tell me about your career in that in terms of creating health policies. So you started with Arizona Department of Public Health Services, AZDH, and you were there for 21 years as a Native American liaison. Did you start off at that position, or was that created?
Actually, I was the first position holder. The position just opened up in 2001, and then I applied for the job. I got the job, and stayed in the job for 21 years. And what I enjoyed most is I'd always had a very supportive leadership at Arizona Department of Health Services and the governor's office, and a partnership with the Indian Health Service, the Urban Indian Health Programs, the Intertribal Council of Arizona, the tribal health directors, the 3 universities. So the job was very enjoyable. Basically, it was partnerships. And again, going back to culture, community decisions are made by communities, and really just working together, learning how to work together. Going backward in our culture, how people used to have farms and all coming together to harvest the crops, as a community. And so I think it was just a natural in terms of working with our partners.
Before we get into the collaboration and some of the products, or at least some of the policies that came out from all this work together, talk to me about some of the tribal health inequities and why is it there are so many disparities?
I'll start with the latter part of your question. Just history. Just history. Just all the tribes, our tribes have had negative history in terms of colonization and oversight government, and just the clashes of cultures and lack of resources. These tribes were basically stripped of the abilities to self-manage in the early days and resources. And so obviously if you don't have control of your life and if you don't have resources, then all kinds of things start happening. And then you just have the clashes of the culture, where we as Indian people are trying to retain our culture, the languages and ceremonies, versus just the outside influence. Because when you're going through school, as you know, you really don't learn about yourself. You learn about the other culture and everything that they have. And so, and then that just results in all the health disparities. Like at the Arizona Department of Health Services, Indian people had the worst health disparities, just almost across the board. So like whatever is affecting communities off reservation, it's affecting more so on Indian reservations. Just like COVID, when it hit, because of what I just discussed earlier, multiple families living in one household, long distance to health care. And so COVID just spread, lack of water, lack of housing. It just sort of starts to multiply, in terms of economics and health care,
Right. In previous reporting and other conversations I've had with other leaders, IHS, the Indian Health Services, is a huge healthcare provider for Native people. But the big, comment we get on that is cuts to funding year over year and things like that. Does that make it harder for Native people to get some of the health services that they need?
That's a really good question. I'd like to say that as Indian people, healthcare, people sometimes use the term prepaid healthcare. Well, I believe as Native Americans, we were the first prepaid healthcare program because our ancestors were forced to give up the land in exchange for these treaty rights, which includes healthcare. So we've already paid for the health care. So you're right. But it's not an entitlement. It's discretionary. So every year, the Indian tribes and Indian Health Service have to lobby for funding. What has happened, which is very good, is self-determination. That tribes can now, under a system of contracting, can manage their own health care. So what you see now is that the budget is very limited under Indian Health Service, and they're limited in how they can maximize those funds. But when tribes 638 self-determination contract those health facilities, they're able to multiply and leverage the federal funding. So what happens is the tribal 638 healthcare facilities end up having more resources to bring on more staff and consequently provide more services.
What's a recent example of one of these facilities?
Very good question. I think in Arizona, the most recent one was probably Thana-Atam. They took over all the, under contract, they took over all the Indian Health Service on the Thana-Atam, and they created a separate entity to manage those facilities.
When we talk about addressing some of these health problems in Native communities, over years with collaboration with tribes and other policyholders, you're able to come up with this tribal wheel, right?
Yes.
Talk about this elements of a healthy tribal community. You know, it has 4 different parts to it, but really it's extensive in what it tries to cover and reach.
Thank you. Yes, everything is partnerships. Again, when you talk to any of the providers, no one provider has an agency has the necessary resources or the expertise. So everybody has to work together. And so the background on this tribal wheel is really partnership. Vitalis Health Foundation is a foundation that is really interested in working with tribes. And what we did with the tribal wheel, as we call it, is multi-purpose. One is as non-Indians, as we've been talking, as non-Indians become partners with tribes, a lot of the non-Indians have very little work experience or knowledge in working with tribes or knowing tribal background. And so the tribal wheel puts into writing the commonality between the tribes in terms of our health beliefs, you know. And it's really a template. So individual tribes have their own symbolization, their own sacred mountain, their own sacred symbols, their own way of the 4 directions in terms of how life evolves. And so this tribal wheel is a combination of 17 tribes that came together under the leadership of the Intertribal Council to at least put in writing our belief systems and our healthcare belief systems and how we're very unique in that, as I mentioned earlier, self-determination. You know, a lot of non-Indians have never heard the term. They don't know what it is. And so what I tell them is if they really want to work with our people, learn our history. Spend some time, because then you'll understand sovereignty. You'll understand how it's really sacred now to tribes and sovereignty, that tribes make their own decisions and set their own goals. And that's what this wheel does, is that there's an outer circle and an inner circle. And the core is Mother Earth, that everything starts from Mother Earth. And then you got the family, you got the communities. And then there's our 12, what they call social determinants of health. And that really was developed by the World Health Organization and the Centers for Disease Control. So again, the basic model was developed by Vitalis, and Vitalists wanted to see how this model might be applicable to tribes and to work with tribes. And that's how the Intertribal Council, ourselves, Arizona Department of Health Services, the Arizona Advisory Council on Indian Healthcare, how we all work together. And really the model, the template was developed over 3 tribal meetings. And so on the Vitalists website, it explains all the detail.
Mm-hmm.
So health people that are non-Indians that would like to work with Indian tribes, this document is made for them to go over it, and then they'll get a good understanding. It's just like if we were going to a foreign country, we wouldn't just pop
Show
right
up,
in, you know.
Exactly.
We'd have to do our homework,
Right.
you know. And so this is what that's about. It starts to give some. It's just a tip of the iceberg, but it gives them a good idea of the tribal health belief system. Plus, the other thing that I mentioned earlier, my experience in going to school. The other thing about my experience in going to school is that there was nothing about our people.
Mm-hmm.
So when I went through the business curriculum, it was General Motors, Ford Motor Company, Chrysler, those big multinational company, you know, and I had a hard time saying, well, how does that relate to reservations?
Sure.
You know? And so I'm a real proponent for education, and I'm a real proponent for our beliefs. I believe that we have a lot to offer as Native people. And unfortunately, when the Westward movement went place by the United States, we were just sort of just bulldozer over, you know, and like there was nothing in our belief systems and way of life that was good, which we know is not true. We wouldn't have survived thousands of years before the United States if we didn't know how to take care of ourselves. So I believe, I really encourage these types of documents where tribal people put in writing our belief systems, our symbolism, and then our younger people can then study these. And so that these types of documents can then be put in curriculum so that our students have something to relate to. Getting back to the health disparities, I really think that's a foundational piece is that if your people are not talked about and there's no examples, you just kind of think, well, maybe our way of life isn't good, you know, which is not true. And so I believe as a person that everything starts in our mind, that we got to feel good about ourselves. And documents like this for Native people and what we're talking about now gives our tribal people a better, it helps our sense of well-being. And I really believe that if we believe in our mind that we are good and we want to do good, then everything just falls in place. You know, our people will start all the healthy living that we used to know, and really pursue pursue any type of education and be able to have the income to provide for themselves and their families.
Well, looking at this wheel, we have topics like resilience, way of life, self-determination, sovereignty, tribal governance, belief, spirituality. Going in towards the core, we've got spirituality, emotional, physical, and mental. When, say, someone who doesn't identify as being Indian wants to work with these tribal communities, what's the reception been like among them with this wheel? Are they open to it? Are they taking it in stride?
Yes. What I found working 21 years at the Arizona Department of Health Services and all these partners is that they want this type of information because they do want to learn, and they do know that they need to educate themselves and learn, so that as they go into communities, the other thing that this helps too, and that I advise partners, is don't try to, you're not going to bring anything new to the tribes. Tribes already know how to live and what to do, and they're already doing it.
Right.
Like self-determination. They've got governments now. The route is to spend time with tribes. Again, the history, learn what tribes are doing, and then don't try to bring in a new program that may even counter what they're already doing, but support what they're doing. Modify. That's what my message for the 21 years at Arizona Department of Health Service, in addition to just encouraging our non-Indian staff to get educated, is find out those programs and then see how you can support those programs. And that's how you're going to be most successful. That's how you're going to build trust.
It also brings the question up as to how do we get more Native Americans in the health field to work in tribal communities or to become healthcare providers? Yes,
that's a whole nother area, Colton, that you're exactly correct on. And so there's a number of different programs. And besides this wheel, there's different programs to help promote and introduce health professions to the youngest age possible. And there's been several attempts, models, pilots, and the 5th grade is like where students can start to understand careers. So there's actual programs, and again, very much like what we're doing with the Tribal Wheel, is we've got a number of programs and tribal people and partners working with our young people and introducing them, not only healthcare, but other professions. But specifically in healthcare, we just recently, I say we as I'm still working, but I still identify myself with my former colleagues, there's a program that just got passed by the legislature because it had to have legislature and governor approval, and it's called the American Indian Health Education Center. There are 5 of them in the state, and we work together to create the 6th one, to just work with tribal people, to do just what you just said, work with our people on and off reservation to go into the health professions. And then those that are already in the health profession, working with them for advancements, So having adequate, culturally competent healthcare, like now, these 638s, they all have a traditional healing component, so that, like when I was growing up in Shiprock, my parents didn't have the choice of having a Navajo medicine man right there on the staff. We had to do it separately within the family traditionally, but now there is a provider on staff who's a traditional healer. So that option is given to patients now. And again, that's self-determination, and that's self-government, and that's where we're using what we already know has maintained our people for centuries.
I'm curious if you've ever seen someone who is non-Indian experience or seen the reaction of a patient saying, "Yes, I would like a traditional healer," who maybe not have seen that before in the past. Like, what has their reaction?
There's a lot of people. Like, again, when I was at Arizona Department of Health Services, I would explain these ceremonies and how they're conducted, and they're just amazed. They're sort of blown away.
It's crazy, right? There's like 21 tribes here in Arizona. It seems like it would somehow pass along to them in some capacity.
Yes. And they're really interested. They're really amazed, because it's even for them, they've never been exposed to it because it's not in the curriculum.
Right.
It's something you just it's just word of mouth, But yeah, again, I'm really big on education. That the more our non-Indian partners are educated to help us, then the better outcome would be. And I always like to use the term win-win.
Mm-hmm.
So everybody benefits, And of course, in healthcare, the patient gets the care that they need,
Where do you see the healthcare for Indian people the next 5-10 years?
Well, I think as we talk, more and more of our people are going into the health professions. And so obviously we got that voice.
Mm-hmm.
And then it was like my position at Arizona Department of Health Services, where internally I was the voice. So the voice is being heard. And the tribes have really worked together to make sure that they're heard in Congress. They're heard in the White House. And there's all kinds of mechanisms that have been established to ensure that. So I just see good things. I think just across the board. I think mainly because we're taking control. I mean, I'm saying we, Indian people,
mm-hmm.
we're taking control. We're in the driver's seat. And that's only good, because we know, a basic philosophy in health is local people know best. And in emergency, it's the local people that are going to have to take care of themselves.
Right.
So the more our people learn and assume their own management of healthcare, and I see diversification
mm-hmm.
in the future. Like right now, it's very limited on reservation in terms of specialty services. But I really see as the economy grows and as our population grows, I really feel that just like off reservation, there's going to be supplements to the healthcare. So it's just good because it really helps economic development too. I really believe that healthcare is a real driver for economic development because it employs a lot of people and it brings in, they get payroll.
Right.
And then they can buy locally. And then, the whole economic multiplier effect. That's the business side.
I should have been a doctor. I'm thinking about like all these economic opportunities.
Yeah. So I just see good things.
Yeah.
And of course, I've learned, and I've already knew this, just so many dedicated people.
Right.
There are just so many dedicated people. And working overtime, And that's one thing that I really believe in, just like me. The wages you need, to provide for your family. But working for our own people, our motivation is just sky high.
Right. Absolutely.
We'd put up with all kinds of stuff, just make sure that our people are getting served. So I think as more of our people get into the health profession, the whole spectrum from like policy, working for the state, doctors, EMTs, physician assistants, radiology, the whole spectrum, that dedication level is just going to be, I think in the past, not to be too negative here, it was like 8 to 5. Mm-hmm. That was it. And most of the providers lived off reservation, Now it's 24/7 because it's our people. And we're living on the reservation with the people, So because of those, I just see good outcome. Then again, the thing I miss is a lot of education taking place, So people, and then it's being mixed. It's being mixed with the non-Indian health knowledge, unlike reading your label
mm-hmm.
on your food.
Mm-hmm.
and learning about all those components. And then what we already knew in terms of traditional foods,
Right.
and non-processed, and all the stuff that we used to eat before the prisoners of war and before the reservation system, I really think there's a good mix. Plus, again, a lot of these programs, the dollars are coming in, and you got to meet their guidelines, which aren't developed by us as Indian people, but because we're now running those programs at the local level, we can bring in the local teaching that our people can relate to. Just like COVID. On Navajo, there was the 6 feet that...
Oh, the 2 sheep apart?
Yeah, the 2 sheep apart.
Yeah.
Where else would you see 2 sheep
right, that's
apart?
culturally relevant, right? Yeah, makes sense.
In other communities, stuff like that,
Yeah.
So I'm very, very confident. And then I'm just amazed at the young people, when I talk to them. Man, when I was their age, they're so far ahead of where I was at that age. And so I just feel good. I just feel good that our healthcare is just going to get better.
Well, with the announcement of NAU getting a medical school, ASU getting a medical school, bolstering U of A's, hopefully there's more programs in place to get more Native students to become these health leaders. Yes,
and then the traditional healers are getting a lot more respect. So I don't think we're too far off from having a traditional trainer type of school.
Oh, that'd be interesting.
It'd be interesting to see how that comes together, because I know there's certain things culture-wise you don't talk about or you don't do that part. But just like Medicaid and access, we have to really fight to have traditional services as their as part of their service products, which I think is really discriminatory, because like if I need a ceremony, I have to go back to Navajo and have that done, and I don't get 1 cent of being covered by insurance.
Right.
Whereas I can go anywhere here in the city and go to a provider, and insurance will pay for that. Whereas, hey, this was here long before.
It's health and wellness.
Yeah. And so why are we being discriminated against? Mainly because the people that are managing and developing these programs are not Indian.
Right. Now you got to get up to the national level.
That's why again, I know our people, as they're more getting to not only healthcare, but all these fields, and they advance.
Right.
And then they can be, like you opened up with policy, and developing these programs, and our voice being there. I mean, we all work together on it. All right.
Oh my gosh. Well, that was a really cool conversation, Michael. Thank you for being here on this podcast. And you're right. Helping to serve the Native community is why I do this podcast. So hopefully some younger person or someone who has ever thought about having a career in healthcare decides why not.
Right. And it's very rewarding and well paying too. I mean, you can raise a family and have that good feeling in your heart that you're helping your people.
Yeah. All right, so lunch is on you today. All right, thank you, Michael.
All right.
Appreciate it.
Thank you, Colton.
All right,
I really enjoyed it.
Thank you. That's it for this episode. We'll be back next week with another one, so stay tuned. This is Here Before, Here Now.
This is Here Before, Here Now, an Arizona's Family Originals podcast.